Gottfried Hirnschall is Director of the World Health Organisation's HIV Department and a leader in the field, and he joins us now. Dr. Hirnschall, thanks very much for coming onto the show. Where are we now globally with the HIV response?
Well, first of all, thanks for having me. I think it's fair to say we're having some very good news and we're having some not so good news. The good news is that globally we see fewer people die of AIDS. We have fewer infections than we had before, and more people are able to access services. And when we talk about services, one that stands out is that many more people are able to access treatment. The number that is widely circulated here at the conference is that 13 million people by the end of 2013 were able to receive treatment, which is a major increase compared to the previous year or previous years.
And what are some of the key WHO recommendations for treating and preventing HIV around the world?
Well, we have in 2013 actually launched new treatment guidelines that really propose that people would be treated earlier, because we know this is good for people's health themselves, but it also has a prevention benefit. What we are seeing now is that many countries have actually already incorporated these recommendations into their policies and are moving towards implementation.
So how can we increase equity in service access to these key populations?
Well, as you say, equity is a major issue here. And these key populations, men who have sex with men, sex workers, transgender persons, persons who inject drugs, persons who live in prisons or in other closed settings, they really are not able to access the services they need. And if they do access services, they don't often respond exactly to their needs. In addition, we obviously know there are laws in place that further criminalize their behaviors, and really it's an area we have to focus much more. WHO in this conference is launching guidelines, key population guidelines, that look specifically at what are the services that these people would need, that these populations would need, how could they best be delivered, understanding that the traditional services will need to be tailored and that there needs to be special focus. But they also speak to what we call the enabling environment, looking at the legal frameworks, encouraging countries to review their laws and policies so that access barriers could be removed.
And with the increasing cost of healthcare, how important is universal coverage in the treatment of HIV?
Well, clearly we are now thinking about ending the AIDS epidemic, so moving towards universal coverage for the HIV services is key. We need to still scale up treatment. In that context, we need to have a special focus on those populations that have difficulties in accessing the services, the key populations. And we really also will think about enhancing the quality of the services, because we know sometimes people get started on treatment, but in the course of events they get lost, and they may not be able to follow it through, and they may not actually be virally suppressed. So focus, quality, equity, special attention to key populations in that context.
So certainly there's some big issues there for governments and policymakers around the world.
Certainly a big issue for governments and policymakers, but I think really big issues for all of us. Governments obviously have to take the lead in the countries. Us, the UN family, so to speak, we have an important role to inform on best ways to move forward. The WHO in that context, obviously through its role on making appropriate recommendations. Civil society having a very important role in shaping the demands, but also more and more so in service provision at the country level. Community systems are very important, and it's really the collective effort that will get us there, we hope.
Dr. Hirnschall, thanks very much for joining us, and enjoy your stay in Melbourne.
Thank you very much.